Now that we've finished going through the normal functionality of skin and hair and nails, gone through what their functions are, gone through the parts, the pieces, we need to look at some things that are more abnormalities. In that case, we're going to start with cancer. Now, in the case of cancer, it's usually based on an unusual cell growth. And most people associate tumors or moles with cancer. But tumors and moles, a lot of times moles honestly aren't cancerous, and tumors you never quite know. Most of the tumors aren't going to be cancerous growths. Cancerous growths have a very particular signature to them, a very particular growth pattern to them. And a lot of these different types of moles, and tumors for that matter, are benign. They're not going to metastasize. They're not cancerous growths. Metastasize is spreading of the cancer through the body. One of the key crucial factors for cancer is this p53 gene. Now, it's not something you've got to memorize the exact gene name, just it's an interesting little fact. How if this p53 gene is disabled, that increases the risk for cancer because the body doesn't have the same mechanisms to stop or prevent cancer from growing in the first place. So it's one of these things they found out with a lot of people that have cancer. They found the p53 genes also disabled at the same time. But cancer is a huge ongoing research currently, trying to figure more about how to stop it, how to prevent it, and how to get rid of it if someone already has it. So it's a constant evolving field there. But let's start with basal cell carcinoma. Now, this kind of red blob you're seeing here, that is a basal cell carcinoma. Of the types we're going to talk about, we have 3 different types we'll talk about. This basal cell carcinoma is the least malignant, so least cancerous in that case. It's still cancer, but it's the least malignant of the 3. And it's pretty much the most common skin cancer. It's going to start in the stratum basale, hence the basal cell, bomb cells. In the stratum basale, they're going to basically proliferate and invade down into the dermis, as well as upwards above the skin. You can see this is a raised elevation here. But the redness of it is because of the blood supply. That's the invasion of the dermis. By going down the dermis, it allows for an increase in blood because that's where the blood is. But with a cancerous growth, most cells, they come up against something, they stop growing. In the case of cancer, they just push it out of the way and keep on going. Cancerous growths don't have that same stopping point when they realize, oh, we're pushing against something. They just keep on going and going. Now, this basal cell carcinoma, though, thankfully is a slow growing process, which gives it extra time to be caught and treated. Now, most of these will not metastasize, but if it sits there long enough, it can metastasize. But thankfully, the slower growth means slower until it metastasizes. More often than not, 99% of the time, surgical removal is all that's necessary. Depending on how long it was there, it might be surgical removal and then either radiation or a little bit of chemo. But mostly surgical removal, as long as I can get all the cells in the whole area. So it'll take a little bit of healthy cells as well, just to make sure we got them all. But clear the whole area out, and most people are good to go. 99% has no problem at this point. The biggest key is, though, to find it earlier. Don't let it sit there for months or years. Find things earlier, especially in cancer. Okay, find these earlier. It's a lot easier to treat them and move on with life than having a constant battle throughout. Next up is the squamous cell carcinoma. That's this thing you're looking at here, squamous cell carcinoma. Now this comes out of the stratum spinosum, right from the keratinocytes. Usually you'll find it scalp, ears, lower lip, places that have constant exposure to sunlight, which is UV radiation. Now this one does grow rapidly, unfortunately, and it will metastasize sooner than the basal cell carcinoma. So again, it's important to find them as early as possible and remove to prevent metastasization or moving on throughout the body. So as long as it's treated early, usually has a pretty good prognosis. Radiation therapy, surgical removal, try and get everything out of there and then clean up anything left over in the area via irradiation there. So the squamous cell carcinoma. The third one is melanoma. Now you can see 2 different examples of melanoma here. One is more blackish, one is more reddish. Remember, melanin, you have two different types there. One was more yellow-brown, black, one was more red. So depending on which type of melanocyte and melanin we're looking at, depends on the coloration of the melanoma. Now, the melanoma is easily the most dangerous type of skin cancer. This is the one where you find this, you need to make sure you're getting it treated very, very quickly. Come on, next. The reason to find it so quickly is it's highly metastatic. It's going to spread very quickly. And a lot of times it's resistant to chemotherapy, which causes a problem because that's one of the main ways it's treated. So there are other avenues of treatment, but again, this needs to be found sooner than later before it starts spreading and popping up elsewhere. And when it does metastasize, it doesn't just stay in the skin. It can get in the bloodstream and go to any part of the body, causing cancer anywhere else in the body as well. So that's why it's important, again, early detection, constantly check through and make sure you see what's going on. But they have this ABCDE account set up here. It's a way of trying to figure out, should this be concerning or not, based on what I'm seeing. So the first one, asymmetrical. In the case of asymmetrical, the two halves just don't match up. They're not growing in a normal circle or square or oval or any shape you want to describe it as. One side's coming over here, one side's going down here, but you can tell they're asymmetrical, not even. Borders. The borders aren't regular. They're bouncing in and out. It's not a nice normal shape to it. So you have these irregular borders. Color. Now, obviously you can have moles or freckles that are browns and blacks. You can have reds. But the key here is varied shades. So you have varying coloration within the same mole or freckle or tumor or wherever it is. So having different colorations, not one consistent even color. Diameter, larger than 6 millimeters. 6 millimeters, think of the size of a pencil eraser, give or take. So if it's larger than that, something to be checked out. And the last one, evolving. Evolving is the shape is changing. It's one shape, one point, look a couple weeks later, maybe a month or two later, and also it's a different shape. If it's changing shapes, not being consistent, even growth, that's another one that could be a clue saying, hey, you know what? Might want to get this checked out just to be safe. So ABCDE, kind of checking through these as a self-check. If you end up saying, hey, a couple of these are matching up, maybe go get checked out. Be safe just to make sure you know what's going on. So how do you treat these? A lot of them are surgical removal, and then they'll try immunotherapy. Because again, chemotherapy doesn't work, so we're doing immunotherapy. So if the lesion is 4 millimeters or less, prognosis is decent. But 4 millimeters thick or more, unfortunately, it's not a great outlook at that point. Because by the time it's hit the 4 millimeter or thicker time, that then is a really high chance of it metastasized and already started to spread around. All right, let's shift into burns. Now, obviously, burns are not going to be something growing in your skin like cancer would be, but this is something that happens to your skin. Still not normal function. In burns, they're classified by degrees: 1st degree, 2nd degree, 3rd degree, 4th degree. In the case of a 1st degree burn, most people have probably experienced this. It's a sunburn. It's when the skin turns red. It's not quite the most comfortable, might hurt a little bit, might get a little scratchy, but you've damaged the epidermis. That's the thing, is only the epidermis is damaged. So you're only going into the epithelial tissue. You have not reached the dermis. But this 1st degree is still not great, because every time you damage the skin with a burn, it leads to potential mutations of the cells that will then make all the future skin cells. So they've linked a higher incidence of burns to a higher chance of skin cancer later in life. So it's one of those things, even 1st degree burns can be problematic. You want to be careful about not having these from at least some exposure. Now, obviously, a 1st degree burn from a fire or a stove has a different take on that. 2nd degree, you've now cleared the epidermis and you're into the dermis at this point. So in this case, you've gone partially into the dermis, not all the way through, just partially into it. Same symptoms as the first degree, so redness, pain, a little bit of swelling. But now you've increased blisters. Because between the epidermis and dermis, you might start to get a separation, a fluid layer that will create a blistering effect in there. So you have second degree burns. Usually blisters accompany this. Third degree burns, entire thickness of the skin now. We've gone through the epidermis, we've gone through the dermis, all the way down. In these cases, these can be pretty problematic and quite painful. But the interesting thing is, the actual burn itself, nerve ends are destroyed. So the physical spot in the middle of the burn won't hurt. It's all the edges around it where you still have the nerve endings that hurts. And that will definitely hurt. Third degree burns, and for that matter, fourth degree burns, can be very problematic based on infection and fluid loss. Because you completely damage the whole entire skin layering. Fluid can easily leak out, causing excess fluid loss. And you have no barrier against bacteria entering in. So in both third and fourth degree burns, careful treatment of the burn site must be accounted for. As I have here fourth degree now, fourth degree, you've actually gone down into the muscle and bone being impacted. Skin's gone, you've burned part ways through the muscle and potentially even burned the bone itself. So both of these, third and fourth, can be very problematic, especially depending on how much the body is covered by these burns. And that's where this little graphic comes into play. They kind of estimate based on how much is covered. So you can see the trunk is 36% of the body. Upper limbs are 9% each. Lower limbs, 18% each. Those are percentages of the skin. So each lower limb is 18% of your overall skin for your body. So depending on the burns, they can estimate how much the body is covered in burns. Because depending on how much is covered, depends on course of treatment. So in the case of third and fourth degree especially, the more amount of the body that's covered, the more problematic and the more serious it is. And don't get me wrong, all third and fourth degree burns are serious. But if you're covering 30, 40, 50% of the body in third and fourth degree, that is life-threatening problematic potentially. So hopefully it wouldn't be an issue and they can bring someone back. But again, the more it's covering the body, the more problematic it is. And in those cases, they can't just heal. Third and fourth degree, they're going to need skin grafts and other things to help the skin heal because the skin cells just aren't there to heal back from that point. So a little estimation of percentages of covering the whole body. So some problems with the skin from cancer to burns. Obviously neither one's good, but how they affect the skin and what's going on with them at that point.